Hello everyone, welcome back to GrowMed. Welcome back to another session where we are discussing the important keywords which will help you to crack the clinical questions. Like what you need to do is, if at all a clinical case will be coming in the exam, you will be just finding these words, and if these hints are given in the question, you need to match it with the options given and rule out, and by that you will be easily able to crack the clinical cases. So let's look at some important hints. So we will be discussing the mixed bag. So it will be a mixed bag where we will be discussing some surgery, some medicine, then some ENT cases, so that your brain will go into a 19 360 direction, like all the 19 subjects, and it will help you in the exam hall. Okay, so starting from the first case. So the abdominal pain. A patient comes with the abdominal pain, fever and fatigue, and you can see flask shaped ulcers and encovy pus sauce, and you can also see that SGPT is increased. So see, these are the two important things which you must note down in the question, because these are the common things, right? ये किसी भी चीज़ के साथ हो सकता है. These things you can find with other features, other diseases also, but the flask shaped ulcer and encovy sauce pus is most commonly seen with the amoebic liver abscess. And this is a very important topic, also a repeat topic. The liver abscess is so important from the surgery, and questions are also asked on its investigation of choice. So it is the ELISA. So questions can be like, they can describe this whole case and they'll ask what is the diagnosis, or they can ask what is the investigation of choice there, or they can also ask the treatment. So the treatment will be the metronidazole. Okay, so we will be giving the azole drugs, which are the parasitic drugs, antiparasites, because it is caused by the amoebias, so amoebic liver abscess. Simple. Okay, then moving on to the next question. So a patient complaining with hypothyroidism, decrease in the parathyroid hormone, dyspnea, dysphagia and hoarseness, and on examination you find that the thyroid is hard and woody. So what will be the diagnosis? So take 30 seconds, think what can be the answer, and try to crack this clinical case by yourself. So you'll be like, अगर ये सही हुआ या नहीं हुआ. Okay, so the answer is the Riedel's thyroiditis. Okay, so the pathology of this is the thyroiditis. That means the inflammation. So inflammation of the thyroid causing the tissue to turn into the fibrous material. So the tissue will be turning into the fibrous material, so that there will be a decrease in the release of the thyroid hormones, causing this hypothyroidism. Okay, so this is the thing. So this is the things which you must remember from this Riedel's thyroiditis. Then moving on to the next clinical case. A young boy coming with hypoglycemia with muscle cramps and normal after the rest. So the other words which they can describe this thing is the exercise intolerance. Right, simple words. So a young boy coming with exercise intolerance, and on examination you can see that the serum lactate and the serum glucose is reduced. So what will be the diagnosis? So think about it, what can be the answer? So exercise intolerance, then young boy, then decreased glucose, hypoglycemia. So it is a type of the glycogen storage disease, mainly the type 5 glycogen storage disease, which is the McArdle disease. So important from the pediatric, then from the biochemistry, and the questions asked on these are the enzyme deficient. So it is the muscle phosphorylase enzyme which is deficient in case of this McArdle's disease. And also another important thing to remember, that this is the most common type of the glycogen storage disease which can be seen in the adults. So don't confuse with the young boy in the history, because sometimes they can also describe it as an adult. But what you need to look at is the exercise intolerance, which is the main, and second the hypoglycemia. Okay, then moving on to the next clinical case. So here the patient comes with chronic alcoholic, so history of chronic alcoholism, then on examination confusion, ataxia and painful eye, which are remembered by the mnemonic GOA, global confusion, then ophthalmoplegia, then ataxia. Okay, so these are the things which you will be remembering by the mnemonic GOA, and the cause of this one will be the vitamin B1 deficiency, which can also be written as a thiamine deficiency. Okay, so due to this thing, a deficiency, we can see these features in the patient, and this is also important as in integration with the multiple subjects, like it comes with the PSM sometimes, then it comes with the biochem, then comes with the psychiatry, surgery, OBGYN, medicine. Okay, so a lot of subjects, and this is a very famous question asked, like this is almost repeat topic, that B1 deficiency, Wernicke's encephalopathy, and Korkos phenomenon. Okay, then moving on to thinning of hair, alopecia, scaling of scalp, and consumption of raw eggs. So see, this is the hint word which you need to look in the question. Whenever there is written consumption of raw eggs, and if you see this hair or alopecia, and in the option if you find the biotin deficiency or the vitamin B7 deficiency, then just closely mark this as the answer, because that one will be the answer. Okay, so for biotin, we can see alopecia deficiency. Then moving on, chest pain, radiation to the neck and the interscapular area. Then on X-ray you can see widening of mediastinum, and the lower limb blood pressure on one side is reduced, whereas one side it will be increased. So what can be the cause? So this is the classical presentation seen in case of the aortic dissection. So this is a classical finding seen with the aortic dissection. So whenever you see this widening of the mediastinum, go with the aortic dissection, because that one will be the cause. Then moving on to the next clinical case. So a young patient coming with the midline neck swelling, moves on degglutination, and moves on protrusion of the tongue. So what can be the diagnosis? So the diagnosis is thyroglossal cyst, which is also a very famous question asked from the surgery. So this is almost a repeat question and asked multiple times. Okay, so you need to remember all the things related to this thyroglossal cyst. Then moving on, a woman who is 4 days postpartum. So this PP is the postpartum. She comes with fearfulness, mood swings, and occasional insomnia. So what can be the diagnosis? So the diagnosis is the postpartum blues. So this is an important thing asked from the psychiatry. So the postpartum illness, psychiatric illness, we classify it into the blues, then the depression, and then the psychosis. So you need to remember all these things, and I have discussed all these things in detail in the psychiatry revision video. So do watch that videos also. So this blues coming with the day 3 or 5 days, then depression coming into the months, like 2 3 months, comes in the 2 3 weeks, and psychosis coming in the months, so it comes 2 to 3 months. And then moving on to the next question. So a diabetic mellitus patient comes with ear pain, black discharge, and you can see cranial nerve 7 palsy. What will be the diagnosis? So it is malignant otitis externa, which is also called as acute necrotizing otitis externa. And you need to look at the hint word, that is the cranial nerve 7 palsy. Whenever these three things are described in the question, then think in terms of this otitis externa. Then moving on to the diabetes mellitus patient or immunocompromised like HIV, or a patient who is on steroids. In them, there will be pain in the nose and you can see black discharge. So this classical case was asked in relation with the COVID-19, and now this case is not asked in the COVID-19, so they ask it in relation with the diabetes mellitus, and the diagnosis is the mucormycosis. So this is also a very famous question asked nowadays in the Fmge about the mucormycosis. So this is important from the microbiome point of view also, and also from the ENT. Okay, so these are some important clinical cases which we have discussed, and these are all mostly the previous year questions. So that was a quick review of the important clinical cases which you must know for the FMG. So thank you so much guys for watching this video. I hope this video will help you all in the revision. All the best for the FMGE. May you ace this exam. Like the video, share it with your friends, and comment below. This is Dr. Padmini, your mentor for the FMG. Once again, thank you so much. Bye bye.